What are the warning symptoms of a retinal detachment? The precursor of a retinal detachment is when the vitreous gel, which is in the centre, forms the body of the eye, detaches from the retina. And as it does so, it stimulates the retina. The retina doesn't feel pain, but when it's stimulated, it's seen as flashes of light. Secondly, when the vitreous gel detaches, it can pull on a blood vessel and cause a very small amount of hemorrhage within the eye. So if a patient has an explosion of flashes of light or things floating around, that's a warning sign that there may be a tear formed in the retina, which will then lead on to a retinal detachment. So I always say to patients that if you get any of those symptoms, or if you start to see a shadow coming down over your eye or lifting up from the bottom of your eye, that you need to seek attention within a couple of days. The quicker a retinal detachment or a tear in the retina is picked up, then the more effective treatment will be.